the day we get to hear from Governor Evers. Governor, just before the call today, I saw that the CDC just announced that we're #1 in the country of the percentage of COVID-19 vaccines received and administered at 94.39%. That's just phenomenal. And thank you for all that you do for our state. Husch Blackwell is a firm that is particularly focused on healthcare. A lot of the folks on this call today know my colleagues in our Madison and Milwaukee offices like Tom Shorter and Kate Besch and Pat Coffey, Tom Godar, Meg Pekarsky, Robin Liniger, and me. But more importantly, I want to say, Tim, how proud we are to be part of Wisconsin Health News. Going back to the beginning of the launch of Wisconsin Health News, we are huge fans of WHN and the daily emails we get that sort of keep us all up to date on what's going on. Governor, you're no stranger to healthcare, being the son of a physician and the dad of a physician. And so it's with a particular sense of gratitude that we say to you, all of us at Husch, how grateful we are for what you're doing for our state in what can only be described as a pretty tricky time, huh? Yeah. So Tim, let's not so much talk about HB and turn it over to our governor and go forward with the presentation today.
Well, Bruce, thank you so much. And thanks again to Husch Blackwell for all of your generous and longstanding support. And thanks again, Governor Evers, for being here virtually with us today. It's been just over a year now since you issued your first COVID-19 public health emergency. And our state has changed in so many ways since. Well, I think it's safe to say that we are in a better place than we were 12 months ago as more residents get vaccinated and case numbers continue to fall. We're definitely not out of the woods yet. So I want to, in this discussion, reflect on this past year, but also talk about where we go from here. In addition, we're hoping to discuss your proposed budget for the coming 2 years, which includes a number of healthcare issues, some of which are likely to garner bipartisan support, but some of which might face tougher odds. So Governor, first though, I want to talk just a little bit kind of overall, how has this year been for you, both as governor, but also as a Wisconsin resident, amongst the tragedy and destruction this virus has doled out? Has there been any small silver linings in this for you?
Well, yes, and it has been a challenging year for everybody. I don't care if you're talking about people that live in our nursing homes or folks that are attending our schools and everybody in between. It has been a significant challenge, and it's playing out in a whole bunch of ways. And maybe we can get into that a little later. But issues around mental health those issues have ratcheted up in importance, and so it has played out in a lot of different ways that, frankly, even transcend this virus. But first and foremost, the thing that I'm really proud of in the state, and it's that people really have been able to understand how important wearing a mask is and staying home and trying to save lives, basically. And and considering all the kind of the political push-pull on all those things, I'm convinced that the vast majority of the people of our state, every time we've gone to court or not gone to court, they actually have continued to wear masks and continue to stay home, and that has been really rewarding for me. I know there's some that don't, and I know some that believe that that piece of science is debatable. But at the end of the day, the resilience of the people of the state has been really rewarding, and also, frankly, bringing together multiple agencies such as Department of Health Services and Wisconsin Emergency Management, and good gosh, our Wisconsin National Guard folks have been every place over this last year, and now they're putting shots in people's arms. So really critical help around that. And also, I believe that our efforts to convince people to mitigate the best they can, stay at home as much as they can, has saved lives. And we see that in data from Johns Hopkins. We see it from the University of Wisconsin-Madison research. And so all that it's been an extraordinary challenge, but it's been we have had some successes, and I want to make sure that people understand that. Do we mourn every single death that happens in this state? Absolutely. Now, as far as things that I wish could have happened better, certainly unemployment insurance was a problem, and the system was broken to begin with, and unfortunately, when you have that, hundreds of thousands of people becoming unemployed in a single day, that created havoc, and I feel badly that it took so much time to kind of right size that to a point where we can limp through until we get to a better place. The other thing that I still have frustration around, and I will always, I guess, because I've had plenty of time to get over it. But somehow I've been unable to convince the Republicans and most of the Republicans that it is important to follow the science, and that's disturbing to me, because we know that we need to follow the science in a pandemic, and I've been unable to move that needle, and that's been frustrating. I think it happened early on when our president decided that he was not real interested in following the science either.
Governor, thank you, Governor. Speaking of science, and how the state is responding to COVID-19, as cases decrease in the state, how is that going to change how the state is responding to this pandemic? Do you expect to issue another public health emergency and mask mandate next month when your current one runs out?
Well, we will follow the science, and we'll see how dramatically the number of cases is seemingly decreasing. That's something we have to be concerned about. Right now, I think our daily cases are similar to what they were last September, and that was just frankly, disaster when things just kind of lost control as the pandemic ravaged our entire state. Every county and every city had issues. So I'm a little concerned that we are looking at things with rose-colored glasses, that everything is on a decline. But where we are right now is frankly right where we were last September. The difference clearly is we have a vaccine, and we're getting it in people's arms. So I'll take all that into consideration, but I think we still have to, whether there's a mandate or not, and I'll decide then. But we still should be masking up. We still should be doing whatever we can to mitigate the disease from continuing to be transmitted in our state.
And so it sounds like the number of average cases will be one of those main factors you look at when you make a recommendation. And what is there a certain number you're looking at that we have to get below, maybe 300 cases a day, or what is that metric that you're looking at?
It's more of the shape of the curve, how dramatically it is. If it's plateauing at a low number, we're still, a plateau does not mean it's moving in the right direction. So it's more of the angle of the curve rather than a number.
How normal of a summer can we expect in Wisconsin this year? For example, what type of summer activities do you think that you personally will feel comfortable doing? Like, do you think you'll be ready to go to a Brewers game or a summer festival in Madison?
I'd love to go to a Brewers game, and I can't wait to do that. But I think that is a slight possibility towards the end of the summer. I know the Brewers are doing everything they can to make sure people are safe in their facility and doing socially distancing and wearing masks and so on and so forth. So, but I think things will begin to return to normal. But you think about like the Wisconsin State Fair. My wife and I have gone 51 straight years. The record was broken last year, but I guess it wasn't because they didn't have a state fair. But having been there 51 times, it is. I have to believe it's going to be a challenge to keep people safe. I mean, we still have a disease in the state, and so I'm not making any suggestions about the state fair or any other venue. but there will have to be some hard thinking about how those things can happen, maybe differently than in the past, and hopefully be safe. We have to be safe. We have to follow the science. Now, as far as me personally, I'll continue to do what, frankly, a lot of other Wisconsinites do. We've doubled the numbers, and I think in every category, of people visiting our state parks, being outside, and monitoring that you're not with a whole bunch of other people continues to be a good way to get exercise, and frankly, a good way to get outside and use the resources we have as a state. I think things will start to loosen up, but again, it is going to be about us getting shots in the arm, and also people, while we're doing that, help us make sure that we're pushing this pandemic to make it gone. That would be perfect, but get it to a point where people feel safe.
So you said, Governor, you said last week that Wisconsin will meet President Biden's goal of all adults in the state being eligible for the COVID-19 vaccine by May 1st. Michigan, which is vaccinating its population at a pretty similar rate as Wisconsin, said it will reach that mark on April 5th. Illinois Governor J.B. Pritzker said recently they might be able to do it before May 1st as well. What are the chances, do you think, that Wisconsin will be able to open eligibility to the general public for vaccines before May 1st?
I guess anything is possible. We knew we were going to do May 1st before the president's comments even. So anything's possible. For example, today we just announced that instead of April 29th, we are going to be, excuse me, I'm in the wrong month, March 29th. We're going to be moving up to March 22nd, the whole group of people that have pre-existing conditions, comorbidity, and so on and so forth, because of what we're doing so well. As Bruce talked about initially, we are in a good place. And so we will continue to reevaluate that. I think it's premature at this time to say that, the last thing we want is for somebody that maybe has chronic kidney disease and a comorbidity way that person is going to be competing with people that have no health issues at all. We have to make the priorities are there for a reason, and we have to make sure we deal with the people that are either in positions that that cause them to possibly get the disease or spread the disease, or have some other issues that create a problem for themselves, and especially as it relates to comorbidity. So we will always look at pushing it up. We want to get shots in people's arms. And most of your listeners know this, is that we have an extraordinary number of people in the healthcare industry and other venues that are taking on the job of vaccinating people in Wisconsin. We have a president now who is doing a great job of getting us more vaccines than we had ever anticipated at this point in time. So we'll monitor that, and we'll get the general public involved as soon as we can. But it's certainly latest as May 1st.
So it's almost hard to imagine right now, but we're hopefully and likely not too far away from a situation in which we could have more than enough vaccine in Wisconsin, and the public health challenge will no longer be about getting these systems in place and determining eligibilities. It'll be focused on reaching enough people who have not gotten it yet, so that we can get to this herd immunity. What role is the state prepared to take to help assure hesitant residents that the vaccine is safe and connect with communities where take-up rates are lower?
Yeah, absolutely. And that is the major concern. And, I think the kind of the belief in science is also playing a role in that. There's concerns that people just from a political end of things are vaccine hesitant also. So we will be doing everything in our power, and a lot of it has to do with making sure that we have local folks, local validators that people recognize as local validators. Of course, it's great for me to encourage people to do it. Great for President Biden to do that. But at the end of the day, it's the local pastor, and frankly, I've seen data that reinforce something that I've always believed is that, and when it comes to our healthcare, people really do respond to their local healthcare provider that they go to on a regular basis, and we're going to need them to step up too and get local physicians, local nurses, local people that people trust. They need to be reaching out to their local pastors, and so we will be helping to organize that. We'll, as well as the federal government. I just got a call before we talked, before I jumped on this event, and from the Biden administration, and they have a fair amount of money that they're going to be using, but it's not going to be people at the rock stars and the athletes. All that will play a role. But they assured us that some of those resources can be used and should be used. The majority of them should be used for those local validators. And we continue to be concerned about this. We're doing whatever we can to do, pop up vaccination events across the places where we know that there's some hesitancy, but it's going to take a lot of effort by a lot of people to get this done.
Right now, as you alluded to, polls show that overall Republicans are more hesitant about getting a shot than Democrats. What specific plans do you have in place to work with leaders from across the aisle on this? Speaker Voss, for example, did a public service announcement on the importance of masks with Congressman Mark Pocan. I mean, could you imagine doing something similar like that with the speaker around vaccines or other Republican officials?
Sure, absolutely. But again, I understand that there is there's a political edge to this. We've all lived that for the last year. But at the end of the day, I think people are going to trust a local validator more than Robin Voss and I, or a state senator and the neighboring state senator. All that is good, and I'll take any opportunity to do that. But at the end of the day, it's going to be that local pastor, that local healthcare provider, somebody, some really important person in that neighborhood. And that I'm not just talking about urban Wisconsin. We need those local validators all over the state of Wisconsin. This is a concern. We have to get to that herd immunity point of view. We can't allow us to be sitting around 50, 60%. That would be a waste of time and energy. Frankly, we have to continue this now. We can't take another whole year to get to that point.
Wisconsin is expected to receive more than $3 billion from the COVID-19 relief bill signed last Thursday by President Biden. How do you plan to prioritize that funding? Where do you think most of that will go?
Yeah, and that's a great question, because it's a real benefit for us as a state and as a nation. The priorities are pretty much where it has been in the past. We have to make sure that, first of all, we know that we still have a virus that's hanging around, and it's still infecting people at the same level that it was last September, before the big increase that we had in October and November. So it's around PPE, it's around making sure that we're doing testing, making sure that all the public health things that those folks do, both at the state level and at the local level, are in place. In addition, we have lots of people that continue to struggle financially because of this, and we did a great job with the other CARES money to get money to people. And frankly, especially in our small businesses, that we just scratched the surface at the best, and we need to get money out the door to people that have struggled financially to this event. And so it's going to look very similar to CARES number 1 and number 2, and getting that money out the door as soon as possible. We're still in the middle of a pandemic, and for us to drive it down and make sure that we're able to open appropriately, that's where our heads are at.
Do you think there's still a need for a state COVID-19 relief bill in light of this new federal act?
Well, it took a long time to get the handful of bills that we did do. So I think what we have from the federal government now is there may be other pieces. There are definitely other pieces of COVID-19 that, frankly, Speaker Voss and Senator Lemieux and I agreed on. I think we agreed on about 25, and I've seen maybe 3 or 4 across my desk that I have seen. So there are probably some things out there that we need to take care of or could take care of. But as far as influx of resources, I believe this CARES, the money that is coming out from the Biden administration will be the answer to that. I don't think we need to come back, have them in session and identify money. We needed money for redoing the unemployment compensation system, and they gave us the go ahead to do it, but they still didn't have any money attached to it. So I'm doubtful whether it could happen, and we're not going to wait for that to happen. We're going to get the money out the door from the federal government to our schools and our farmers and our small business people across the state, especially our tourism industry. It's struggled mightily, and because of the nature of it, it's going to continue to struggle for a period of time.
What role do you think the legislature should play in determining how this new federal money from the relief bill is spent?
Well, I'm not going to be snarky here, but there were several hundred days that they weren't even willing to come in the session to deal with that. So, this is something that has to get out the door. Every expenditure that we make is online. If they wish to understand exactly where this money is being spent, that's fine. But I don't see how 100 people are going to be able to be making a decision on a daily basis where this money is going and how we're going to get it out the door and how we're going to make sure that we're accountable for the expenditures and, frankly, accountable to the federal government. This is an executive branch issue, and we will go forward given that.
Would you veto a bill that would increase legislative oversight over how funds like these are spent?
Yes. Absolutely. We have to get it out the door. We will be accountable, and we have to get it to our healthcare providers and the people that struggle, and making sure that unemployment compensation that gets out the door too. On a regular basis, people will know what we have spent and where we're spending it, and it will be online.
So I want to shift a little to the budget and the remaining time we have, and on the continuing to talk about federal money. The Legislative Fiscal Bureau said in a recent memo that the state could save an additional $1 billion over the next 2 years by expanding Medicaid under the Affordable Care Act. This is in addition to the nearly $600 million in expected savings by doing this. Republican leaders have in the past shown little willingness to bend in their opposition to Medicaid expansion. $1 billion is a lot of money, though. Have you heard from any lawmakers since this memo came out and since the relief bill was passed that have changed their mind or are rethinking their opposition based on this new figure?
Well, I haven't heard of any mind changing. I think some people may think about it and not voice it in order to avoid the wrath. But if you look at, this isn't something that is just some part of some wish list. The money that we send to Washington, D.C., we pay taxes, and those taxes go to D.C., and we're not getting our fair share back any way you slice it. And $1 billion is a fair hunk of change, and we can use that with great target. We have disproportionate health outcomes in the state. We have for years. We want to make sure that we have programs for moms that have disproportionately bad outcomes in birth and taking care of their babies right after birth. So there are all sorts of things that we need to invest in the state of Wisconsin. Mental health, as I mentioned before, is a burgeoning issue, not only in our schools, but in our society. Those things are really important. In addition, by having those, by saving those state dollars, we can take those state dollars and invest in the things that people in Wisconsin really care about. Their schools, making sure that we have a good healthcare system, and fixing the roads. There's some basic values there that both Republican and Democratic families have at the top of their heads. So I'm hopeful that this idea that Medicaid expansion is nothing but welfare. I've heard that said many times. It's about making sure that our citizens of the state of Wisconsin have the best healthcare system possible, and this is one way to do it. So I'm hopeful that the additional incentive that the Congress has put in front of us is taking a sincere look, because red and blue states have passed these bills and with great success, and we're looking forward to a positive response.
How much of your health proposals in your budget, in your spending plan, are tied to Medicaid expansion? If that is not approved, are there certain health proposals in your budget that would not have funding?
Yeah, I would say our investments to help is a lot of the issues around mental health, whether it's regional support in that area, certainly the Well Baby, Well Mom initiative, and also the piece that I think is really important is to kind of expand thinking about what Medicaid is taking care of as it relates to connecting the dots, whether it's issues around housing, whether it's issues around other issues that really bedevil people that are in such a economic situation that we can help with Medicaid expansion. So there's a number of things, but it does boil down to the fact if we just want to think about increasing the ability for 90,000 people to have better coverage than they have before, and also making sure that we're investing in a much larger way around mental health issues, and making sure that our people are able to have a higher quality of life, but also the savings that we would have as it relates to our state funding can mean more money for our University of Wisconsin system, or our K-12 system, or fixing our roads.
Governor, we're quickly running out of time here, but I wanted to ask one last question. I wanted to end this with a similar question that we've ended most of our virtual events over this past year. But a year into this COVID-19 pandemic, what are you most optimistic about right now?
Well, I'm optimistic that we're going to get out of it in a real positive way, getting people shots in the arms, and but the bottom line is through all this and utilizing the vaccinations to end this, along with continuing mitigation efforts, Wisconsin people have shown me and frankly the country how resilient they can be during a pandemic. Do I wish there had been better coordination and thinking around following the science? Absolutely, I do. But at the end of the day, what I've seen time and time again is that this pandemic has brought out the best in people too. Neighbors helping neighbors, being resilient, coming up with new ways to sell products, being willing to step up, and when something has to happen in the neighborhood, that people are banding together safely, making sure that their neighbors are safe. And so I believe that resilience and that Wisconsin values that I talk about neighbors helping neighbors and communities pulling together under difficult times, that will continue to exist in the state of Wisconsin, but actually at a higher and more productive level.
Well, Governor, thank you so much for taking this time today. Thank you to all of you for tuning in. Thank you to Husch Blackwell and our sponsors for making today's discussion possible.
Thank you so much, Tim.
Thanks.